Hi, my name's Sarah Maxwell. I'm one of the consultant microbiologists at Stepping Hill Hospital, and I'm here to talk to you about a very important organism called Clostridium difficile. You may know it as C.diff. This organism is especially important in patients who, for various reasons, are more susceptible to it, such as the elderly and those with long-term complications who may be on immunosuppressives and antibiotics. There's two important things about this organism, C.diff. It produces spores, which is a form of the organism where it hides away and is protected against ordinary washing and ordinary detergents. Secondly, it produces a toxin, a poison, which acts on the gut and can cause diarrhea, sometimes quite catastrophic. If we think of the way this organism gets into our body, we can think of ways of preventing its disease. It's in the environment, especially in the environment that may be contaminated by somebody who has the disease. So, since it causes diarrhea, the toilet seat, the toilet handle, the bathroom door handle can be contaminated with the spores, and therefore cleaning, not only with a detergent, but with a mild form of bleach, household bleach, is really important to get rid of this organism. The organism is not going to jump from these areas of contamination straight into the patient's mouth. It has to get to there via mainly hands. And therefore it's really important that hands are cleaned. Unfortunately, because this organism forms spores, the alcohol hand gel, which is very good at getting rid of MRSA and flu, is not active against this organism. So hand washing with soap and water thoroughly and drying is really important. The next barrier that the organism comes across is the high acid secretion in the stomach, but that may be depleted if you're on long-term PPIs, proton pump inhibitors, that suppress the acid secretion, or antacids, and therefore that's something you might want to talk to your doctor about. Once into the gut, the organism is kept from causing disease by the nice friendly bacteria that are there. But again, these might be depleted because you're on an antibiotic course. So it's wise to talk through with the doctor about whether antibiotics are needed and how long the course is needed. And it may help to take some extra good bacteria in the form of a high-grade live yogurt. However, some people will develop the diarrhea, and if you have been on an antacid or antibiotics recently and you get diarrhea, it's good to mention this to the doctor. There's a quick, simple test that can be done in my laboratory to diagnose this disease, and as soon as it's better to diagnose this quickly so that something can be done about it. Obviously, the person with the diarrhea will then become a source of this organism to others. So it's important that all the hygiene things that we've talked about, strict hand washing, cleaning of potentially environmentally contaminated things like the toilet seat and the toilet handle is important. Thank you very much.